Have you ever been in a situation to know what it's like to receive bad news? And I'm not just talking about any regular type of bad news. I'm talking about a news which concerns life or death, where it's pretty much the end of the road for yourself or one of your loved ones. This is in the medical space, we call these sort of illnesses as terminal illnesses. So the point where no amount of treatment, no amount of support, no amount of medication looks like it's going to work to help the patient get to a better position. These are unfortunately very distressing times for both the healthcare provider as well as the patient to navigate through them. So instead of how I do my other videos, which is usually like a how-to, I'm going to really critique on what to say and not to say, or what to avoid when you are in a position of delivering terminal illness news to a patient as a healthcare provider. Welcome back to my channel, everybody. For those who don't know me, my name is Shweta. I'm the founder of Healthy Dynamics. We are a coaching practice that helps healthcare providers from non-English speaking backgrounds become better communicators by embracing empathy, authenticity, and influence, whilst improving their English language fluency in order for them to connect better with their patients, provide better care and support, and make a true impact and difference and stand out in their workplace as a person of excellence. So I have done quite a few videos in the past on how to deliver bad news to your patients and a lot of the intricacies of why it's not a good experience for anybody involved, how you can navigate through it, as well as looking at specific scenarios. I'm going to leave the link of those or the list of those videos over here. Now, just a trigger warning before I start off this video. Obviously, I'm going to be talking about death and terminal illness, and so there's a lot of it is going to be quite distressing. So if that's something that's going to trigger you, I'd suggest that you skip this video altogether and have a look at the numerous other videos, 60 odd videos that I have on this channel. So let's get straight into it. So as I mentioned in the very beginning, delivering the news of a terminal illness is very, very difficult. So this, delivering, it's not just any regular bad news. This is taking it to a whole new level, because you are pretty much saying that there is no hope, there is no way forward. There's nothing that no amount of treatment is going to help or work. So how do you deliver news in this situation, in that particular way? So very obviously, you have to watch things like your body language. You have to be compassionate, empathetic. You have to listen actively, create space, and really double down on your non-verbal communication. We all know that. But what I wanted to really bring up in this video is what exactly to say, which has that, a good balance of there is fact and clarity, whilst there's also that equal balance of empathy and compassion. Now, at the same time, you might also, as a healthcare provider, feel very, very helpless in this situation. And you might be experiencing a lot of emotions yourself, in terms of you might feel quite defeated in terms of, I was not able to help this patient. It's pretty much the end of the road for them. And that's not at all easy. And it's very important that you also look after yourself and get support from your colleagues and peers and subordinates and anyone else that you're working with. So I'd highly recommend that. So sort of gauging what exactly to say to make this, it's never going to be a better experience, but to make it a more tolerable, navigating it to create that environment that's more supportive and empathetic, whilst I think showcasing the fact that you are also human, and in many ways you are also feeling a little bit upset and distressed by this news. So let's get into some of the sentences that you should avoid saying, or it's not really a good idea to say, if you want to really focus on delivering empathy and support and creating that space in which patients can also feel like they can vent to you and they can turn to you, and at the same time keeping it very factual and clear. So let's get straight. News is not looking very good. So obviously the patient is coming in to get news of, whatever the test is or the scan is or whatever results it is that they're awaiting. Now this can be in a situation where if you're a veterinarian and one of your clients is going through terminal illness like cancer specific, that's one of the the most regular sort of versions of terminal illness, but there are many others. Similarly, if you draw the analogy to a human, if you are, say, speaking to if you're an oncologist and you're speaking to a patient directly or their caregivers, instead of saying that the news is not looking very good, what you don't want to do is put fear and distress into their head straight away. Instead of saying the prognosis is not looking very good, you can, on the other hand, say that there's no easy way to say this. So that way, you're sort of saying, you're also feeling that, this is not going to be a pleasant conversation, but at the same time, you're preparing them, breaking them in gently when you are delivering this news about the fact that there's going to be bad news to be expected. So that's just one of the two things. So instead of saying the prognosis isn't looking good, or I'm sorry to have to tell you this, or the news is not good, you can say there is no easy way to say this. Okay? So that is one, do and don't, essentially. Number two is, this is difficult news. And yes, 100% we all know that it is difficult news, but by saying that, you're making it more difficult for the patient to digest, accept, and come to terms with. So instead of saying, again, in that situation, instead of saying that it's difficult news, you can say it's okay to feel however you are feeling right now. So you're giving them that space for them to really experience and express their emotions is very, very important in this situation. And the other example where another phrase that you can use is, there is no right or wrong way to react to this. Again, by saying that, you are really giving them that space, that environment where they will receive, really close support, and they can receive empathy and compassion. And one thing I would highly recommend that you mention is that I'm here to make sure that you get all the help and support that you're possible, and make the experience as comfortable and make you feel as supported as possible. So that goes without saying. So you can use these phrases instead of saying unfortunately. Yes, we know that the news and the information is unfortunate. It's not something that people want to hear. But at the same time, you have to not only focus on breaking them in gently, but also reassuring them that there is help and support available in any way, shape, or form, medically, obviously, for the patient as well as their caregivers in this situation. So, and the other one I see a lot of healthcare providers being quite hung up on is the concept of prognosis. Now, again, I'm not denying that prognosis has to be mentioned, and what it's going to look like, what's going to happen in due course of time in this scenario, depending on what the illness it is that they have. There's no denying that. However, starting off by saying something like the prognosis is not looking good, again, a patient may not know what prognosis is, number one. So you have to make sure that the information that you're keeping, the tone that you're using is quite simple. So instead of that, you have to really be working together with the patient and be a team player, saying something like, we'll work together with you and your family on finding the best way forward. And that is going to include managing their pain and symptoms and making the transition as smooth and comfortable and possible. And you have to offer them guidance and support and make them reassured that they don't have to go through this alone. And that's really, really important, and offer them options as well. So obviously, a treatment or a cure is not an option at this point because obviously the illness is terminal. But what you can do is lay out for them when they are in a better frame of mind to be able to understand all that. What options they would like to consider or explore moving forward. And it is important, it's vital, I would say, in this case, that you have to give them not only space but also time. So in those consultations, when you are in a position where you have to give them some sort of distressing or bad news, just remember that it is going to probably take more than one time for them to come back into the same issue. So whilst yes, you have to refer back to the situation where the initial news of the terminal illness has been delivered to the patient, just going into the very next step of what they can do, laying out options and everything else, that is not a good idea to ever mention that. So during that very first visit or consultation, it's most important that you let the patient know that this is difficult news, it's a difficult time. We're here to provide help and support, and again, giving them that time and space, not only in that medical setting, but also in their home, and also refer them to other places that they can turn to for help and support. Like, say, for example, where I live in Australia, we have places like Lifeline and Beyond Blue, and these are basically hotlines for people who are feeling any kind of distress or sort of any kind of despair that they're going through. I believe there is also a line for caregivers of loved ones. I'll look it up and I'll leave the link over here just as information. So those are available, and obviously if you know anyone that can provide them help and support in terms of their mental health, so some sort of a therapy, something along those lines, definitely give that information to them. And it's also important that you practice patience with your patients. That's a little bit of a pun, but obviously being a healthcare provider, patience is one of the things that you have to be very, very, very good at. But also in this particular time, you have to be very cautious, and because people who are they'll be more fragile and vulnerable than usual. So in that situation, if they are, if you see patients and their loved ones really breaking down, showing signs of distress, it's important to not rush through the process of taking this to the next stage or the next process. So yeah, the bottom line is you have to really reassure them that you are on their side. They don't have to do this alone. There is help and support available by yourself and all of your other colleagues, other team members, anyone else in the healthcare space or everywhere else. And that the focus is to make the patient who is undergoing this terminal illness make the transition, smooth and comfortable and dignified and pain-free as possible. Now, if you do remember, I mentioned in one of my very earlier, this was sometime last year, mentioned in one of my polls, people who are going into the end of life, and I spoke about it in the context, obviously, of should patients be given the right to end their life with dignity if they're facing a terminal illness or whatever else that might be. If it is legal in your country, give them that option. I know, again, it's a very controversial subject, and I personally am a big proponent that patients and their advocates should have that authority and they should have that right to decide what's best for them. But I am aware that there's a lot of political and legal underlying things to consider here. So that's why if it's an option in wherever your patient is residing, do give them that option that when during due course of time, of course. So these are some of the ways in which you can navigate through delivering the news of a terminal illness to a patient. As I said, if you're in a better frame of mind, check out the other videos that I have just to get a little bit of a foundation on how to deliver bad news to a patient and all the other nuances on that one. And as always, make sure that you hit the subscribe button and the notification bell to stay updated on these videos on a weekly basis. Thank you very much for your time, attention, and presence, and I will see you next week, same time.